There is so much interesting things that happen behind the scenes, but of course, it is now time we look at our GMU Agenda segment where you're able to have feedback. You just go to our social media platforms, you go to our WhatsApp number, which is 0709 60 25 92, or you send us an SMS or WhatsApp message. Go to our social media platforms, Twitter, Facebook. Will be able, of course, to respond with the guest in studios. And this morning, we are going to be handling something very interesting, something that brought the world to shock. That was the new COVID-19 variant, the Omicron variant. But we'll also be discussing more regarding vaccination in Uganda as we gear up to the opening of the economy, full reopening of our economy. Once again, I'm Robert Chirabo Nyonyintono, and with me in studios to discuss this is Dr. Ampaire Immaculate, who is the Senior Medical Officer, Ministry of Health, in charge of Vaccines and Immunization Division. She is a very frequent visitor here, and I'm very sure she's excited to be with us this morning to give you all that you need to know regarding vaccines, immunization, but also what you should do when it comes to the Omicron variant. You're most welcome, Doctor.
Thank you indeed, Mr. Chirabo. Good morning, viewers, and it's a privilege to be with you this morning.
Well, Doctor, to begin with, we have a poll question that is talking about mandatory vaccination.
Okay.
We heard that the ministry is working along to bring this. We saw in Kasese. I just want to get your view, not as an independent person, as a doctor. This is our poll question. What more should be done actually to promote vaccination against COVID-19? I want to get your opinion on the mandatory bit of it.
Okay. Thank you, Chirabo. We've already seen there are discussions on mandate and mandatory vaccination. But through the pandemic, we've seen Ugandans comply to the SOPs in terms of hand washing, sanitizing when you're entering service points like banks, shops, overall the country, and also wearing masks. So we saw good compliance following the presidential directive and guidance to the citizens. So I think the first step would be to provide the information to the citizens and also follow the directive of the president that vaccination is mandatory for people who are eligible to allow for safe reopening of the economy and reopening of schools, so that those who are most at risk of severe disease and death are fully vaccinated before that. So there is a need to balance and also debate between guidance and accessibility of services. Because I don't think by and large we have a big issue with hesitancy. For the last 8 months, the struggle has been availability of vaccines and hence the prioritization of the highest risk group. That's what we've been doing for the last month, so not hesitancy. So now, if all factors are held constant and vaccines are available and services are brought closer to the people, that's when we would now see against enforcement. But mandate is not legal, it's not punishable. It is just a directive until you get going on. All employers, please ensure your employees are fully vaccinated. Schools, ensure the teachers are fully vaccinated before the terms are open. Health workers, it is more of mandate and the government declaring what they are contributing in terms of protecting the citizen and the working class or service points where there are crowds. If you're coming to a bar, can a bar owner say that if you're coming to my bar, please, the vaccination site is here, go to Chisenya and then you come. So that is the balance we are looking at.
Well, still on that, have we gotten to that level now that the vaccines are available, they're accessible, we have enough human resource to carry out the exercise? As government of Uganda, as your ministry, have we gotten to that point?
Yes, I think for now we are now at a stable state of availability of vaccine. We've received over 30 million doses since the start, and as I speak, we've deployed 14 million to the districts, and we have about 15 million at the national medical stores. So the issue of logistics is not an issue in terms of availability of vaccines, and Uganda has a well-distributed health system, and we think we have the capacity, and relying on the lower local government structures, the LC and VHT systems for mobilization, I think we have, and we are ready. And we've done it in about 5 regions so far in the accelerated mass vaccination campaigns in the country.
Doctor, the issue of manpower. I've gone to some of these vaccination centers. Yes, the vaccines available. You know, one deters people sometimes, the long queues. If I'm to leave UBC, say, I'm saying, well, let me go, like people go for lunch breaks and do other things apart from just taking lunch. If I'm like, maybe let me go and get vaccinated over lunch, so that by 2, if I'm supposed to be on my desk, I'm there. Have we reached that level in Uganda now, that you can easily go, quickly get this jab, come back and return to work?
I think in the
Or is it about killing an entire day?
No, in the campaign mode, of course, you expect lines because of intensified mobilization and what. But with time, when all these 7 days are over, the vaccine is still available, people can still go and have the vaccination within their convenience and time. Yeah. So the issue of capacity of the human workforce is not a question here, because eventually the vaccines will be with us and beyond the campaigns. So actually the challenge we've been having is low turn-up, because so far in the regions where we have done the mass vaccination, we've done about 41% of the turn-up based on the vaccines we've distributed. So the issue is not the lines, as you're insinuating. The issue is the turn-up. People have not turned up as we had initially desired. Yes.
Back to the Omicron variant. First and foremost, doctor, what is this all about? You know, with COVID-19, we've had right information, we've had wrong information. And one of the things that has derailed this fight against COVID-19 in form of vaccines has been the so much wrong information that is out there. Omicron, first we had, is very lethal, spreads very fast, no symptoms, no signs. You just wake up and it seems you're gone. Briefly, from the medical perspective of it, give us knowledge regarding the Omicron variant.
So the Omicron is a new variant or new type of the COVID-19 virus. We know that, like all organisms, you know, they change, they evolve to survive. And the emergence of these new strains, the Alpha and Delta, where we've come from, are a clear indication that actually we've not achieved the required coverage for immunization and herd immunity to be able to not give the opportunity for the virus to thrive and be able to change. So the emergence of new variants is showing that clearly we have not reached the herd immunity, and there's need to do more in terms of vaccination coverage. And as I said, organisms, human beings evolve to be better, to be able to survive. So this is what we are seeing. We are not yet clear on terms of how lethal the virus is. People are still studying it. The only challenge is the virus seems to have a bit to change faster and spread faster, and also evade the immune response among the population. So we are waiting for more information, but what you can do as people, the SOPs, hand washing, masks, avoiding crowds, social distance are still applicable, and also vaccination is still also the secondary prevention measure that is in place. So there's no need to panic. Viruses change, viruses evolve, and we know that even COVID-19 was the old SARS. But this is a new variant as well. So when people tend to relax in terms of vaccination, this is what happens. The organisms take the opportunity to thrive and turn into strains that are more lethal, more virulent, and having more capability to spread, and therefore prolong the pandemic. So there is evidence that within the vaccination globally, we have not interrupted the transmission.
When you talk about interrupting the transmission, what are we referring to? Because for you, in the medics, you may understand that, but to my ordinary viewer, it seems we need to interrupt the transmission. So how do we interrupt the transmission? Usually
it is like for, I can take it like for Ebola, what they do. If you have an Ebola outbreak, it is picking all the cases in the field and the contacts, isolating them like we initially did, treating them, and they're sort of contained, and then vaccination and protection of the rest. Eventually that you contain the virus. Or through polio, you detected a case and then you bring mass vaccination and you stop transmission. But clearly, due to the limited availability of vaccine and the need to prioritize, we have not reached that threshold, what we call herd immunity, immunizing many people so that even a single case may not be able to spread to the rest. That's what we call the herd immunity.
Doctor, with the little I've read, one thing that is clear is vaccination is not necessarily assurance that you don't contract a disease, that particular disease that you're vaccinated against. So then, even if you collected all these people, had them vaccinated, still won't we have people contract COVID?
Why scientists have reservations on telling you that you will not get the disease is because of new vaccines and ongoing studies. But we know for most of the vaccines, there's also ability to actually prevent, minimize the risk of contracting the disease.
Okay.
But for COVID-19, that assurance is not here yet. That's why we are telling you, we've only seen that the number of hospitalizations and death is what is being observed now, and it is the trade-off. So what we are saying, do not relax and say I've been vaccinated. Please maintain the vigilance to ensure that you don't contract it. It's because studies are ongoing and we cannot confidently say that you will not get the COVID. But what has been observed is the
boosting
severe
of your immune
disease,
system.
the risk of death and hospitalization has been reduced.
Okay. That's
what has been said confidently. But we know vaccines also have the capacity through routine immunization. We know that if our children are high now, more than 95% of our children are immunized. The incidence of outbreaks, of measles and polio, we have seen that reduce. So let's observe and see, but let's do our part as individuals and also organizations to ensure that we partake of the guidance that we have so far.
Going back to vaccination in this country, you've talked about one, we had the issue, we didn't have vaccines in this country. We're hearing of them. We even reached a point where we said, even if you have the monies, we cannot purchase them because the people that injected lots of money to this science have occupied. Then we had the COVAX bring in. When we talk about over 30 million doses, I think that is just sufficient enough to cover every Ugandan above the age of 18.
Yes.
And more is still coming in.
Yes.
Doctor, but then you mentioned that even when you have these centers, there is low turn-up. What aren't you doing right as the ministry or as government in general?
One may be how the campaigns are being rolled out. It is sort of emergency, trying to hit the deadline of the festive season. So I think there's also limited time for the districts to plan and, clear map out these things and mobilize effectively to the grassroots, and also engaging the mobilizers to ensure that all the households are informed and the elderly are pulled out, persons with chronic care are pulled out. So I think the time provided the districts to plan and engage the mobilizers is also limited. Another issue also may be you say we are coming for a campaign, but the logistics in terms of funding also delays because of the system we take to disburse funds to the districts, and also the time districts take to acquire the funds, meeting the councils, issues of cash limits. So health workers, by and large, are actually implementing without cash. It is we just give them guidance and they anticipate to get the funding. So I think, and also another issue is also access. What is the location of these vaccination sites? We may be stuck on our traditional facilities. People are in the offices, people are in the markets, they're in the bus park looking for money. These are adults, not children, that will be brought. So there is need to go out and really reach where these people are, in the bus parks, the border stages, churches, the mosques on Fridays, and the SDAs, to try to work with community leaders and organize group and ensure we make the service accessible within the convenience of the people that need to consume it. So I think that may be what we are doing. Time, quality of planning, and also how we are stationing the vaccination sites beyond the routine health facilities and outreach sites.
Doctor, let's look at the issue of right information being out there, because at one time it was all about what we need to know about the virus. What is this virus? How do we prevent it? Now when it comes to vaccination, there is so much information regarding vaccines. And unfortunately, I want to categorically state that most of this is false. What are you doing as the ministry to ensure that people have the right information? I noticed where there is a forceful vaccination, for example, remember that no job, no jab, teachers were reluctant. Excuse me. When this came out, you saw how teachers were rushing to vaccination sites. In Kasese, last week, when the police mounted roadblocks and carried out operation, Kasese Health Center 3, around that area, was packed with people because now they knew you can't move unless you're vaccinated. So that means that people are getting this in order to have opportunity to benefit some services. And I want to believe that if they have the right information, they could even go to these centers willingly. So what are you doing to counter the falsehoods as the ministry, that people have the right information, create confidence in them, feel compelled by will to go, not by law, not by jobs, all these kind of coerciveness.
So what we are doing is through the health system, we are training health workers, and also we've provided for effective mobilization. But the challenge may be how it is being done. We've also developed social media messages, IEC materials that need to be distributed to the grassroots, but are these materials reaching the people? So at the end of the day, you have to rely on the local governance, sensation of the VHT, the LC1, who is closer to the person. But naturally also we find that human beings are pushed by what they see. People maybe have not seen what COVID-19 is in some cases, and also incentives, what is in it for me. So the mandate issue and also ease of implementation also matters. Because we saw that initially people washing their hands, putting stalls at their shops and trying to put on masks. So we believe also with proper information, that's why we are here, telling the masses that vaccines are safe, and they're an additional tool beyond the SOPs to ensure that we are protected, and we support the President's guidance of a safe reopening of the economy and schools. So it is up to us as the population to really partake of the investment by government. Vaccines are no longer an excuse, and how we position ourselves to support and demand for the services as citizens wherever we are. So,
talking about safety of vaccines, how safe are the vaccines? That is the question that people mostly ask. We've had people who've been vaccinated then have some side effects, you know, mild headache. Some will tell you I developed a fever. Some will tell you I developed a general body weakness. Others, all sorts of stories. Maybe even some go to the extreme. Some will tell you the moment I was vaccinated, I tested positive of COVID-19. So let's look at safety of vaccines, because this is where we find the fear. Some have even gone to the extreme of saying vaccines have a challenge with manhood. I've had a number of men say, when I was vaccinated. So let's try to create more light on the safety of these vaccines now that I have you, who is directly in charge of this.
Yeah, like all pharmaceutical products and other medicines, our vaccines have side effects. And we know that over 50% may experience fevers, headache, weakness, joint pains. But we look at the benefit vis-a-vis the risk of this side effect. What is the risk of not being vaccinated, Chirabo? And what is the benefit? So we know that the benefit of vaccination outweighs the risks even of the expected side effects that we see. And these medicines are safe. They are approved by WHO, by the National Drug Authority, and they are taken through the system through which you get your Coartem and the Panadols that you don't fear. Okay? And we have a surveillance system. We have, you may have seen contacts on the vaccination cards and stickers where we allow clients to report any concern following immunization. And we are monitoring that in terms of advice, in terms of documentation. And Chirabo, another thing you need, and the audience you need to realize, is that vaccination does not take away what you already have. If you're already suffering hypertension and you get a stroke, ours is to document and manage you and eventually assess the causality. Is this stroke due to vaccines, or it was an underlying or coincidental event?
Oh, okay, so there could be those incidents. Yes,
the vaccination will not take away the problems you've been having. If you're with malaria, vaccination will not take that, but it might augment it because, and you say, I've received the vaccine, that is why I'm manifesting like this. So ours, we have put contacts on the vaccination cards. Please feel free to call those NDA toll-free lines, the self-reporting code, and WhatsApp, so that our teams can get feedback from you and follow you up. We have teams in the field investigating these concerns, but by and large, we have seen that the benefit of vaccination outweighs the risk, and most of the effects are actually coincidental.
If I had COVID-19 and I have mild symptoms, or maybe I don't show any symptoms, and then I go for the vaccination, is it a danger? Because we've had people who say it is wise that before you go for vaccination, you must know your COVID status. Doctor, on that.
We know that most of the COVID cases are asymptomatic. I may be now having COVID-19, and we are not screening vaccination at vaccination sites. So as long as you are symptomatic, you're eligible for vaccination. It is if you have those mild things you're saying, then that's when you should first go for screening. But there is no requirement for COVID-19 tests before vaccination for asymptomatic persons. Yeah.
Very interesting there. Well, it's time I also look at some of the questions that are coming in from our viewers. And in case you haven't, the time is now. Just go on our various social media platforms. The WhatsApp number is on your screen. That is 0709 60 25 92. 0709 60 95. Sorry, 0709 60 25 92. And I'll be reading them. And the doctor in studios who happens to be the Senior Medical Officer, Ministry of Health, in charge of Vaccines and Immunization Division, Dr. Immaculate Ampaire, will be responding to them. Beginning with some that have come in. Well, this one's mandatory vaccination should not be a problem. Actually, people would be willingful to go for this vaccination, but what makes it lose meaning is that they are telling us that even if we get vaccinated, still we can't stop us from getting infected by the virus. Then why vaccination? It's completely loses meaning. So let's live by God's mercy. That is Sunday Dixon Wachiso. If when I go for vaccination, still I can contract COVID-19. Still, good morning, family. Thank you for the show. Counter rumors and misinformation about vaccines with correct information. Unreliable sources of information has invaded the whole community, and the end result is low turn-up for vaccination. 2, let's continue sensitizing on the value and benefits of these vaccines in accordance to World Health Organization, Ministry of Health, and follow the directive of our lovely Jaja, His Excellency, President Museveni. Another one, I am just asking, if you are affected by COVID-19, is there a need of that person to go for vaccination again? That's my question for you, doctor. I'm Samuel. Thank you. I would like Madam to explain why we go to vaccination centers and find no vaccines, and yet we are blamed that we are refusing to get vaccinated. Pasca, a teacher from Kiruhura district. Thank you, Madam. Whenever I try to get online COVID-19 vaccination certificate, it tells me I got 1 dose, yet I completed my 2nd jab. What do I do? That is Eunice in Chegegwa. Well, Eunice, you're not alone. That's something I talked with Doctor earlier on, a case I also experienced. Then, okay, still, these vaccines, ever since I got vaccines, I no longer perform in, okay, that is marital issue in, doctor, I've gotten it. What's wrong? He's asking. Let me first end with this one for now, and I'll be getting back to you. Okay, Kenneth in Mbale, can pregnant mothers also be vaccinated? Thank you, Kenneth from Mbale. And good morning, madam, how are you? Well, no name there. Okay, let's first end at that, doctor. We'll be going through them.
Thank you, viewers, for that. Those good comments. I think I'll start with the one of performance in bed. I'll request you that you read your card and call those numbers for proper documentation and maybe referral for management, so that we can see if it is other things beyond the vaccines. But by and large is the issue for reporting, and also we document and see what's happening. Then on the issue of Chiruhura, we are blaming them for no vaccines, yet they're turning up. So the challenge has been, when we began the campaigns for the last 1 month, we reduced the stock in the other districts. But I know for Chiruhura this week, the campaign was launched yesterday, and please rush to your nearest facility and get your vaccine. Then there was a comment of pregnant women, we are vaccinating them. If you're beyond 12 weeks, please go. Vaccine is safe for pregnant women and women who are breastfeeding. It's okay for you to get the vaccine. And then people are saying, why should we go for the vaccine when still they will get the infection? We say the objective of the vaccination is not to prevent the disease. We are not assuring that you will not contract the COVID-19, but we are saying that your risks of dying due to COVID-19 and getting severe disease will be reduced. So the important thing here is preserve life, okay? And so if you get the COVID and you don't die, that is the objective, but not actually to assure that if you get the vaccine, we don't want to tell that you will not get the infection.
Then the issue of you complete both vaccinations, the 2 jabs, but when you go to get your certificate, it's only 1 dose that is indicated, so you can't get that certificate.
Yeah, we are facing a challenge of data entry. It means your first dose was entered in the system, but your second dose has not been entered yet, so that can be reflected on your online certificate. So if possible, you could actually reach out the health workers and remind them, but generally health workers are overwhelmed, especially in the campaign districts, due to the high numbers. So there is the rate at which data is being entered has significantly reduced following the campaigns. But we know your vaccination card for now will suffice. Okay,
another one coming in. Good morning, Uganda. It's Dr. Rukwago Musa from South Africa. Please make this option and not a must. The vaccination does not give guarantee that you won't get sick, but you are guaranteed that you will have side effects, which might give you more complications.
So the vaccination has actually been optional. That's why we've been consenting. But of recent, we are not consenting because of time and logistics. And what we are saying mandate, people have been wearing masks. Was it compulsory? It was sort of giving our guidance as we should and guiding employers and people that have restaurants so that when you're entering offices, they can support and say, please wear your mask and also provide. So there is need, we cannot sit back and leave it to fate as government. And we know we have deployed an effective tool to the pandemic. We cannot sit back as government and observe, yet we even have the logistics in the country. This is not a must, but we are insisting that every person above 18 should be fully vaccinated so that we can safely reopen the economy and not experience the death and strain the hospitals with oxygen need and severe disease like we saw. So we are saying adults, the vaccine is safe, it works. We have seen it preventing severe disease. We have brought it to the population of Uganda as a contribution from government. Should government sit back and wait for fate? Definitely. So we are saying the product, we are here to say it is there, please go for it. No one is going to come and push you out of your house for the vaccine. And this is not house to house that we shall come knocking at your door with a jab. We mobilize and wait for you to come. So it is, mandate is not legal, it is not sort of enforcement, but it is providing the information, guiding the control points like service points, bars, schools, churches, to comply and give an option for the majority, because we know the majority are complying.
Well, let's go back to your questions. In case I don't read the questions, some are more similar, so I'll be leaving out that. And I'll begin with this one. Good morning, fellow Ugandans. I'm Julius from Gulu. Vaccines take-up generally is quite good, yet amidst other non-patriotic Ugandans who discourage others from taking the jab. Please let's encourage more Ugandans to get vaccinated and still keep the standard operating procedures, most importantly, since many people have now aborted the use of masks. Thanks for the campaign against COVID-19. Another one here. To me, I think government should come up to sensitize the public much about the different types of vaccines. Have not vaccinated because I don't know which one I should go for. Doctor, I think I have about 4 of them. Oh. So he's not been able to make a choice of which one he should be getting. One coming in. Please don't call on this line. It makes it a bit hard. This one is asking where she can get vaccinated. Even our vaccines are done at Bushenyi Health Center 4. This person says they don't have vaccines there. We have, good morning, Uganda. Vaccinated ones cannot be affected by the new Omicron. If no, what is the solution? So this one is, if I'm vaccinated, you know, do the current vaccines give me immunity over Omicron so I don't get severe death? If they don't, then what should be done? I'm just asking, if you are affected by COVID-19, is there, okay, please, I'm waiting for my answer, thanks. Okay, he asked that if someone contracted COVID-19 and recovered, is there a need for that person to be vaccinated again? Because in some sickness, when you develop and recover, you have that immunity. So he's asking, then, does it still make meaning why they should get vaccinated? Let's first answer that.
Maybe I could begin with that one. Yes, you should get your vaccination because you know which strain you got. So we advise that 3 months from after testing negative, you can have your COVID-19 jab. So there is need for vaccination even when you have healed from the COVID-19 disease. Yeah, then for Bushenya, vaccines are coming. Mara has been launched. So please go back to the Bushenya Health Center 4. You'll find the vaccines there. What was the other question?
We had, that is, when vaccinated, can I benefit? Okay, the Omicron and the current vaccines.
The current guidance is that the existing vaccines and SOPs still apply for all the strains for now. So there is need, all we can say is that the vaccine will still protect you against severe disease and hospitalization and death due to all the COVID-19 strains. Yes, so you are protected from that.
Well, I just want to thank you for the messages. In the interest of time, I may not be able to read all of them, but thank you so much for being part of this show and, of course, sending us feedback. We hope you've gotten the responses that you wanted regarding the questions you've sent in. Doctor, as we wind up this segment, what are your final words to Ugandans regarding vaccination and, of course, COVID-19?
Yeah, Ugandans, COVID-19 is still with us. It is real. Unfortunately, we have received the guidance from government to put on our masks, to maintain social distance, avoid crowded places, and also to have the vaccination. The vaccines are now with us in the country, and there is need to ensure that if you're above 18 years, please go to the nearest facility, consult your LC1 and VHT and demand for the services so that we can be protected and support the government in safe reopening of the economy and schools. It will be an embarrassment if we open schools and we still experience what we did in the second wave previously. So please let us, we are the government, we have the resources with us, let us support our health system to work for us as Ugandans. The vaccine is safe, it is free, and it will protect you from severe disease and death. Thank you.
Well said. Thank you, Dr. Ampire Immaculate, who happens to be the Senior Medical Officer, Ministry of Health, in charge of Vaccines and Immunization Department, for having found time. We have no option but to boost our immune system against COVID-19. Strain will keep on coming, but we need to fight severe illness, death, and hospitalization. Don't take us back to history when we are seeing a future ahead of us. Be that Ugandan who gets that jab so that you don't drag us back, because you have then no option but to go back into lockdown. Have a lovely day. Ruben is already here to take you through the world of sports. Till tomorrow, God willing, stay safe, perfect the standard operating procedures. Good morning.